So anterior approach is not new, although everybody's said this is a new procedure. Actually, Dr. Hooter back in I think the 1600s certainly described this. And there is actually in one article that goes back into the 1400s that mentions an anterior approach to the hip. So it's not a new approach, but it is a resurgence of approach to do hip replacements. What it is traditionally, at least in our country and around the world, the traditional approach was quote unquote the southern approach or the posterior approach to the hip from going in the back. And so you split the big muscle, the gluteus maximus muscle, to go in, and you go back and take some of the muscle, or what we call the short external rotators, off the back of the thigh bone in the hip, and then subsequently expose the hip. You cut the ball off, and then you put the parts in. So an anterior approach, again, you don't cut any muscle, and so all the muscle remains intact on the femur. You just split those muscles and pull them out of the way, and then able to get the hip up into position to put the parts in. Again, same thing. You cut the ball off the hip. You put a socket, which is basically made out of titanium and plastic, up inside the pelvis, and then a pin, usually made out of titanium, which will ingrow into the bone, that goes down to in the femur, and a ball, usually either metal or you can use ceramic, that articulates against a plastic or high-density medical grade polyethylene or plastic is the articulating surface. Again, we've got great 18-year plus results with this. Risk, obviously, any risk of any surgery. Again, if something happens later, there can be wear. Potentially, if there is some wear, you can go in and just exchange the plastic and the ball rather than redoing the entire hip.